Some of the major developments we're tracking on this Friday: confirmed coronavirus cases around the world now closing in on 14 million, with more than 3.5 million of those cases right here in the U.S. As well, over 1 million Americans get back on their feet. And with me now is ABC Chief Medical Correspondent Dr. Jen Ashton. Dr. Jen, the U.S. leading the world with cases, followed by Brazil, then India. Brazil, though, is trending downward over the past 5 days. We know the United States is trending upward. You have information about how much of this was predicted. Tell us about that.
Exactly, Amy. So let's go back to October 2019. Johns Hopkins School of Public Health convened an international group of experts to do a pandemic preparedness drill. It wasn't the first one they did. Ironically, they chose a new strain of coronavirus as their simulated pathogen by coincidence. They looked at 195 countries, asked 140 questions over 6 categories like preparedness, detection, rapid response. Here is the 300-page report, but I want to tell you what they found because this might surprise you. First of all, they found overall, and this is a direct quote, no country was fully prepared for an epidemic or pandemic, and overall results globally were weak. Only 19% of countries received top marks for their ability to detect pathogens, and fewer than 5% of countries scored in the highest tier for their ability to respond and then mitigate a pandemic response. So not good scores.
All right. And it's interesting because we did score well, the United States.
Yep.
We were in the top tier, and yet we see where we are now. How did that happen?
Well, not only were we in the top tier, Amy, but take a look at this ranking. We scored #1 in the world in terms of our preparedness. Brazil ranked number 22, and India ranked number 57. These are all countries in the top tier, and these are the 3 countries with the highest cases at this point. So it tells you that if they were scored in the top tier and they are doing the worst, in actuality, there's a big mismatch.
Yeah, what are the factors that contribute to that mismatch?
Well, when you look at this going forward, they really stratified this across 6 areas. And what they were looking at is things like detection and reporting. Are there laboratory systems there that have the capacity for detecting disease? Then they looked at the rapid response to a pandemic, or the ability to mitigate the spread. And is private sector involved in that response? Here we know it is. Sufficient health system to treat sick people and protect health workers. Does that system have surge capacity? Ours is being tested as we speak. And is there compliance with international and global norms such as sharing data and cross-border agreements? These are all part of the parameters that were looked at. They're not only going back to do damage control on this, but they are trying to fix this in real time, Amy, and prepare us for the next one in the future.
Wow. All right. Those were very surprising numbers indeed, Jen. Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.